Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have young and energetic and very efficient Dr. Sunil Shendwe. Though he looks very young, he is a very experienced surgeon, and that too in the transplant surgery, he is expert. He is working as a senior consultant in the as a transplant surgeon at Sagar Hospital, Jayanagar, as well as the Banshankari. Many research studies he has got to his credit, and more than that, he has got many awards to his credit. And most important that I would like to mention is recently Modi ji has launched all over the country the human papilloma virus vaccination. And everybody thinks that is for the girls and that is only for the CA cervix. But it can cause other cancers also. And he has done a research on this human papilloma virus associated with the cancer of the urinary bladder. But today he's not going to talk about the bladder or the liver. He's going to talk to us about the pancreas. Many people do not know what this pancreas is, what is its function, and what is pancreatitis, what is pancreatic cancer, and what are the causes for it. Please explain to them.
Good morning, ma'am. So, pancreas is a very vital organ. It's a digestive organ. It is situated in the abdominal cavity, and then it is in the back of the abdominal cavity near the posterior abdominal wall. So many of the pancreas problems, rather than presenting to you as abdominal pain, it can present as back pain.
The back
Coming
pain,
to the functions of pancreas. So predominantly, I told you it is a digestive organ. It secretes juices, which helps us to digest our whatever food we have. Other than that, it also secretes insulin, and insulin is very important for our glycemic control. That means it maintains the blood sugar. So that is about the pancreas and its functions. Coming to the pancreatic cancer, so it is called as silent cancer because since the pancreas is situated deep in the abdominal cavity, so many of the cancers in pancreas will not present early. By the time it presents, it is very late, so that we are unable to give any proper treatment to all these patients. That's why it is called as silent killers. So that's about pancreatic cancer, ma'am. Coming to the risk factors of pancreatic cancer. So firstly, the age factor. Anybody who is more than 50 is at risk of pancreatic cancer. Younger patients are unlikely to get pancreatic cancer. The other important risk factor is smoking. So people who smoke are at risk of developing pancreatic cancer. The third important risk factor is obesity.
Sorry for interrupting. The smoking, everybody thinks that only the lung cancer. Everybody thinks the lung cancer is caused by the smoking. Or if they eat gutka or something, the cheek cancer or the oral cancer. But they are not remembering that even pancreatic cancer can be caused by the smoking. Why I'm insisting is many youngsters, including the women, they have started smoking recently and it has become very rampant. And that's how, they must remember that they can be killed, if not by the cancer of the lung, they can be killed by the cancer of the pancreas. And that has to be remembered by the youngsters. Okay, sir. Please go ahead.
Yes. So, as you said, smoking can cause pancreatic cancer, but it can also cause one more disease as chronic pancreatitis also. Not only pancreatic cancer, it can cause chronic pancreatitis also. So that also, like as you said, it is not only the lung, every other part of the body also can get affected by smoking.
Correct.
The other risk
all the blood vessels, going to the brain, heart, everything can be affected by smoking. Yes.
Yes. Yes, it is better to quit smoking if you are smoking already.
Yes.
Obesity and sedentary lifestyle, because most of the people sit and work for a long time. So chances that they can get obese, and sedentary lifestyle contributes to increased incidence of pancreatic cancer. So that's why people have to maintain their weight and exercise regularly. Other risk factors, ma'am, is the hereditary factor. There are people who have genetic risk factors, though the number of patients who develop cancer because of genetic factors or hereditary factors is very
Very
few,
low.
but then it's also important risk factor. If you have any
Okay.
family member who has pancreatic cancer, probably you are also at risk of developing pancreatic cancer. Then patients who have chronic pancreatitis are at risk of developing pancreatic cancer. So these are the important risk factors of pancreatic cancer, ma'am.
So if they have had hepatitis, can they have the pancreatitis also?
The causes
No,
are different, ma'am. For
different.
hepatitis,
So
it
viruses
is
are
generally
different.
hepatitis A, B, or some drugs or chemicals. For
Okay.
pancreatitis, ma'am, even like for example, the broad etiologies remain same. For example, alcohol can cause like toxin.
Yes.
Generally, toxins can cause hepatitis. Toxins also cause pancreatitis. But the
Pancreatitis.
toxin
Yes.
for pancreas is alcohol. The virus
Okay.
infection can also cause pancreatitis, but viruses are different. For liver, it is
Different.
hepatitis A, B, C, but for pancreas, it can be CMV and other kind. Broadly, it is same, but the actual etiology may be different between hepatitis and pancreas. But for
Okay.
pancreatitis,
Okay.
most important etiology is alcohol in our practice.
Hmm. Okay. So that means the one message that you are strongly giving to the youngsters is don't touch alcohol, don't touch smoke, tobacco.
Yes,
In case you
yes, ma'am.
have already started, quit right now if you want to
Yes, ma'am.
lead a healthy life. Now,
Yes,
what
ma'am.
are
Yes,
the signs and symptoms? Because you said it's a silent killer, people don't come to you in time. So, what are the signs and symptoms that people should keep in mind so that they can come to you in time?
yes, ma'am. So very important, ma'am. So early diagnosis is challenging for pancreatic cancer, but there are some subtle signs which can tell you whether the patient has pancreatic cancer or no. Most important is loss of weight, unexplained loss of weight, more than 10 kilos in 6 months. It's very important. If you have unexplained weight loss, it can be pancreatic cancer.
Hmm.
Excessive tiredness, feeling fatigue, loss of energy, it's also important sign. If somebody has these symptoms for couple of weeks or months, it is better to get evaluated. The other thing is, ma'am, sudden onset diabetes. If you are 50, 55, you had no diabetes and suddenly you start having diabetes, that can be a subtle sign of developing pancreatic cancer, because diabetes can rarely cause pancreatic cancer and pancreatic cancer can present as diabetes.
Hmm.
Somebody middle age without any risk factors develops pancreatitis can indicate pancreatic cancer. Once they have
Okay.
advanced disease, ma'am, then they will have jaundice, they will have abdominal distension. So these are all
Hmm.
late signs. Most of the patient, unfortunately, when they come to us, they will present at late stage. But if you
Hmm.
can pick it up early, then it will be great. And these are the subtle signs and symptoms which people have to watch for.
Now, what are the investigations that you do to for the early detection and to make a precise diagnosis?
Yes. So, ma'am, as per screening for pancreatic cancer, it is not being implemented currently because number of patients who develop pancreatic cancers are very few. Your doctor, whenever you see with these symptoms, generally the first investigation they will order is ultrasound abdomen. Unfortunately, pancreas is not very well seen in ultrasound because it's situated near the back. So the best test for pancreatic evaluation is CT scan. So that will be ordered by your doctor once he sees you and go through all your reports. Then he will order an CT scan if he strongly suspects pancreatic cancer. Otherwise, generally ultrasound abdomen is a first line investigation. If it is an
Any
advanced
blood
disease,
test? Any
ultrasound will
blood
tell.
test can help us to make the diagnosis or suggest?
Blood test, ma'am. Actually, if you have jaundice, because good number of patients will develop, if they have a pancreatic cancer in the head of the pancreas, they may develop jaundice, and blood test will pick up this jaundice. We do some tumor markers in patients of pancreatic cancer. CA19-9 are the CA19-9 CA are the tumor markers. So these are done generally once, like as an adjunct to the CT
Once you
scan,
suspect the
rather than
diagnosis,
just
you do it.
diagnosing.
Yeah.
Yeah.
Okay.
Yes.
Now, what is the treatment? Because one of my classmates died of pancreatic cancer abroad, where the advanced technology is available, and hence, people have to know what treatment is available and what can be done, and let them not have the negativity that cancer means it is the death. No, we have to see that they can be saved, and what are the ways of saving them?
Yes, ma'am. Very unfortunate, ma'am. You lost your friend for pancreatic cancer. But that highlights that pancreatic cancer is because it's a silent killer and not picked up at the right time. Many of the patients don't get good treatment. But if we can diagnose it at the right time, then we can remove the tumor. So if the tumor is in the pancreatic head, we do something called as Whipple's procedure, and if it is in the body and tail, we do something called as distal pancreatectomy, and you can remove the tumor. And after that, we give chemotherapy and radiotherapy to kill some microscopic residues of this disease. Some
Or any
people, they are
satellites
not,
are there, the nodes that can be destroyed.
yeah, they
Okay.
can be removed by radiotherapy and chemotherapy. And then if initially they don't present not early but not late in the intermediate stage, we generally give them chemotherapy and radiotherapy before surgery and try to get the tumor shrunk, and then we can remove it. That's called as neoadjuvant therapy, and then we remove the tumor. So best treatment is if you can remove the tumor completely and give chemotherapy, radiotherapy, that is the complete treatment. But surgery is
Okay.
the cornerstone if it is resectable. If the patient is in late stage, surgery is not possible, then you can just give chemotherapy for these patients, unfortunately.
What is the survival rate after the surgery and what are the complications?
Yeah, it's a very good question, ma'am. So, pancreatic cancer, though we call it as pancreatic cancer, it has multiple subgroups. So, there is something called as periampullary cancer. So, periampullary cancer can be because of tumors near the ampulla. So, in those cases, the survival is fair. Survival is fair, not dismissal. But if you only consider pancreatic cancer, just pancreatic cancer rather than periampullary cancers, the survival at 2 years currently is said around 30-35%. So 5 year survival is around 10-20%, ma'am. But now
That
with
is that
advent
is
of,
that is really low compared to the other
yes, ma'am.
cancers. Now,
Yes, ma'am.
compared to
Yes,
the
ma'am.
breast cancer and the cervix
Yes,
cancer,
ma'am.
I think this is very low, and the mortality is quite
Yeah,
high.
but the reason being most of the cancers are diagnosed very late, ma'am. But if you can
Yeah.
diagnose at the early stage, then the prognosis can be like rather than 2 year survival of 30%, 35%, we will be able to achieve 5 year survival of 30-35%. Lot of advances being done currently. Recently, there was a news that vaccine being developed for pancreatic cancer to address these genetic factors also, ma'am. The
Okay.
complications can occur. Any surgery, patients can develop steatorrhea like malabsorption or diabetes very rarely. But the complications are part of any surgery. So complications can happen, but generally we are well equipped to deal with complications whenever they happen after surgery.
Okay. Thank you very much, Dr. Sunil. In other words, what you are trying to tell is prevention is better than cure.
Yes, ma'am. Yes.
So avoid smoking, avoid drinking, avoid obesity, and lead a healthy life, active life. And that is the way to keep away from the pancreatitis.
Balanced
And
diet, ma'am. Balanced diet. Satvika
okay,
aharam.
what is that?
Satvika aharam, ma'am. Balanced diet.
Yes. Sasyahara, Satvikahara, timely ahara. That is very
Yes, ma'am.
important.
Yes, ma'am.
And keep yourself always happy and without any bad habits. Thank you very much, Dr. Sunil, for your
Yeah.
beautiful presentation. Thank you.
Yeah. Thank you so much, ma'am. Thanks for having me. Thank you.